Hi, Dr. Izan again with Virtual Medical Scribes, here to do session 3. So we want to go over a review of the documentation, and then we'll go over some specific coding that you'll have, as well as the specific pathophysiology of certain diseases that might come up. So there are different Kahoots to make this fun. So we've done this in our courses, and this is one of the sort of online gaming things you can do to make this fun and compete against your fellow medical scribes. And so we do a lot with medical terminology, so I encourage you to have fun with this, gamify your learning, to fast forward and almost make it artificial intelligence in terms of how quickly you can get better. There are good resources out there. The emergency medicine Scribe website has quite a few different things on medical scribing and resources. And in terms of learning things, you can do regular old flashcards, but then you can do Quizlets and other things that help to fast forward your learning. So I encourage you to really do a deep dive into learning the medical terminology. Literally, this can save lives, especially your physician and provider's life, by you becoming better at your terminology. So in terms of an overview of the medical records, the key is that we have to, as a provider, be in compliance. We have to document exactly what happened during the interview for later sort of reference. So you're going to look at the history of the present illness. You can look at the past medical, family, social history. So the PMFSH, we'll hear that term. The review of systems, again, is a checklist to make sure we don't miss anything. And then exactly what happened on the physical exam. So the record has to be complete and legible. Again, as a computer, that works out very well. And then in your recommendation, or in your documentation, you'll go through the chief complaint, the medical history, the examination, the diagnostic test. You look at the assessment and why you came up with that decision, the complexity, the exact diagnosis, your care plan, and then you, at the end, must put in your identification of both the physician as well as the medical scribe. And there's usually a header that you must have in there if the physician employs a medical scribe. So understand that that is part of the documentation. And in terms of the documentation, we'll look at different levels of medical decision making. And then we also look at all of the other treatments that have been done to the physician. So, and then lifestyle type things, we will ask healthcare maintenance type things, and also habits such as smoking and alcohol. And the progress, sometimes the note, you'll see them in sequence, and so there'll be literally a progress note of what's happening both physiologically with the patient as well as chronologically. There are a lot of codes that are used in medicine, and the two main divisions of the codes that you'll may be asked to document and the provider may tell you about is the E&M codes, which are the diagnostic type codes. So there's the ICD-10 codes, which are the diagnostic codes, and the E&M codes, which are called the CPT codes. So we'll go through them in detail now. But this right here is diagnostic code. So for example, if you have a problem with your iron, it is an E83.19. And so each number means something, and the physician gets very compulsive about which one to use. And then after that, there's what's called CPT codes, which are more for the visit. So two kinds of codes, ICD-10, which is the International Classification of Diseases, the 10th version, which is the most current one. And then there's CPT, which is what it's usually with a procedure or the visit. So ICD-10 is something that just came out a couple of years ago. It really expanded the amount of granularity to the diagnosis, so it makes it very specific. And so each number and set will mean something. So you may be asked about it. And some of them are a little bit humorous. I like this one, which is if you're ever bitten by a killer whale, and it's something that's happened already, you would have the sequela, and that would be this W56.21XS. So there's quite a bit of coding to be learned, and just understand that it's going to be something that your provider usually gets into a certain pattern and you can learn them. But but there's 68,000 different codes. Luckily, there's a lot of resources for us to do that. And this is another funny one. You get a burn due to water ski, very rare, but that would be this V91. So there are 68,000 codes. You don't have to memorize each one of them, but know your physician or provider may tell you about them. And then I want to let you know about some resources. There's the website, or the one for independent physicians, electronic health record is called Practice Fusion. They have a lot of videos. And so this might be a good YouTube to start. If your physician's using Practice Fusion, you can look at this website to come up with a video. So there's quite a few of these learning videos. So it's learning about electronic health records and learn about your specific electronic health records. So now we'll switch over and do what we call the pathophysiology and pathoanatomy of some various diseases that you might hear. So with knee injuries, this is non-traumatic knee injury, and this is one of our students from before that would, the doctor will evaluate them and then eventually go through some of the possible diagnosis. And one of the things I wanted to bring up is some of the tests the physician might mention to you to write down for the exam. So a Lockman test is checking for an ACL. So he may say positive Lockman test, and that's checking for instability or looseness to a knee, a typical thing in football if you get hit from behind, or if you pivot shift. The other test that you might hear about is called the McMurray's, and that's to determine if there's a meniscal tear or cartilage tear. And so these different tests, they'll say positive Lockman, positive McMurray's, and that's what they're talking about here. And that's where you hyperflex the knee and you sort of twist it. And then varus and valgus is a way of testing the knee's stability, both outside and inside. And then with the shoulder, there's a lot of anatomy that you'll need to learn as a scribe, because they may mention that. And then what we'll do is look at different tests. So the NEARS test is a forward flexion to look for what's called impingement, which is really a tendonitis bursitis of the shoulder. And then you might hear the Hawkins test, which is sort of a rotating over, again, looking for this impingement. And then the drop arm test, you'll hear about for rotator cuff tears, that they can't hold their shoulder up and it actually literally drops. So the tests are meant, sometimes named after people, but sometimes they just describe what's happening. So if your arm drops, that's the drop arm test, and that usually means a rotator cuff tear. Now with diabetes, which is unfortunately very, very common, diabetes has various things we have to check. So one thing we'll check is they lose sensation to their feet, so we'll do monofilament test. So this is a small little almost fishing line, and we push to see if the patient can learn it. Typically we push 4 different places, so you might say 4 out of 4 he could feel it, or he can only feel, or she could feel 3 out of 4, so you may be asked to document that. We'll do microalbumin to see, with diabetes, unfortunately, they lose kidney function and they start to spill protein in their urine. Not very much, a micro amount, and there'll be a positive micro test. And then they'll look in the back of their eyes, and with diabetes, it really is the #1 cause of blindness, so you may hear about the problems that they'll mention on their exam from the eye exam. And then hemoglobin A1C looks at the last 3 months, how their blood sugars have been. And so they'll be talking about glycosylated hemoglobin, and the A1C normally is under 6, and it's really bad if it's over 9. And so each time with a diabetic, every 3 months, they'll be checking this. With the sinus, which is a very common infection, they'll talk about parts of the body, and especially up in the head, because our face is actually made of a bunch of different little canals, or little rooms inside that can get filled. And then the other thing in medical electronic health records now is the ability to do what's called expander codes. So you could do something, for example, like say this one, where if I just put in .shimp2, all of this stuff comes out. So it's a nice way to be able to do something that you do on a regular basis instead of having to type each individual one. Your electronic health records usually has the ability to do an expander code, and we can, with a short amount of keystrokes, put out quite a bit. And so you'll be using this quite a bit, expander codes. And you can do it for any number of things, and you can also make up your own. So your provider or physician may have some already put in there, and then you may, as you go along, be able to put those in to help you to document in a more efficient manner, again, to improve access to quality health care, and that patients can be seen, get documentation done, yet you have a better note. And so in general, you'll also hear about this phrase called Occam's razor, which is a problem-solving thing that you may hear your physician or provider talk about, which says that out of all these things, we try to come up with one diagnosis for it. So for example, if you have fever, sore throat, and a rash, you can label all those things, but it may turn out that it's just, strep throat. And so Occam's razor is a phrase you might hear the physician talk about that basically tries to get the most amount of information in the smallest amount of time. And so in summary, think about keep improving your knowledge base. The goal is, we call it CNI, constant never-ending improvement. We have websites, we have templates, we have videos, and again, we here at Virtual Medical Scribe are here to help. Thank you.